Hey everyone, this is Derek with Orthopedic Physical Therapy Products, and welcome to our Next Level content education series in collaboration with EIM Evidence in Motion. Now, for this episode, we've got Heidi Moyer joining us, who is a geriatric PT, and we're really excited because she's going to share lots of wonderful knowledge with us and really start to inspire us as to how learning about geriatric care and maybe even implementing this into your clinician toolbox can help you take your ability to treat for this population to the next level and therefore help more people. So, Heidi, thanks for joining us today.
Yeah, thank you so much for having me.
Yeah, so let's just jump in with a quick intro. You could tell us a little bit about yourself, and then we'll get into some questions.
Sure. So, my name, as Derek said, is Heidi Moyer. I'm a doctor of physical therapy. I'm also an assistant clinical professor at Angelo State University in their doctor of physical therapy program in San Angelo, Texas. And I'm also the program director for the geriatric curriculum for Evidence in Motion. So, I oversee the foundational, the advanced certification, and then also the board prep course.
Awesome. Yeah. Let's start, but really trying to inspire some people here. So why don't you start with a story, or kind of your most inspirational or one of your most inspirational stories you can share regarding a patient you cared for, that relates to kind of geriatric care, how you help them and what that looked like.
Certainly. So, one of the most inspirational stories I can think of is a patient that we are actually still caring for in our on campus pop up pro bono clinic. So, we are working with a lady who was diagnosed with COVID encephalopathy at 80 years old back in December of 2020. She was sent to the hospital, and at that time in late 2020, we still didn't know a lot about COVID, as we certainly still don't know a lot. But she was given about 3 weeks to live. And her family had prepared to say goodbye. They hadn't prepared for any preventative care in the hospital as far as range of motion or decreasing wound incidents because they had placed her on hospice to give her a good death. And 3 weeks went by, 3 months went by, 3 years went by, and she is still with us and on hospice. So her daughter actually reached out to us in the physical therapy department because she's starting to be more alert and awake and reactive, and was curious if there's anything that we could do for her as a department. One of the things that people don't know is that physical therapy services can be provided on hospice, but it's up to the hospice company to pay for those services with the lump sum that they get from insurance. And because of some of the stipulations as far as taking someone to an outpatient clinic while they're on hospice services, it could actually bump them from the hospice services. So we've been treating her pro bono so she doesn't lose access to her hospice service, and she still requires it. And she has gone from sit to stand of 5 people to help hold her up. She's a small lady. She's about 100 pounds. She was very, very stiff from being in a bed in a wheelchair for about 3 years to being able to do a sit to stand with 1 to 2 people, either with or without a walker. And we've been working with her over the last year and helping to, kind of try to address her frailty status, get her moving more. We do have some significant contractures in her feet, so she's not necessarily going to be a functional ambulator, but she's participating more in transfers. She's directing more of her own care. And her daughter was telling us that she feels like she's gotten some bonus years, like her mom is back, and she's able to have more conversations with her as a result of the physical activity and the services we've provided. And it was a really, really unique opportunity for our students to see what people are capable, even towards more end of life care, but also looking at, when you see somebody who's been in a wheelchair and has been very, very sick for 3 years, I think a lot of people are intimidated to work with those folks, which is a common trend we see in geriatric therapy. But that's definitely one of my most memorable stories. We've gotten her on the treadmill for treadmill training a couple of times, and we're continuing to work with her.
Yeah, that's an incredible story, and man, that is very inspirational. And definitely, hopefully, we've grabbed some clinicians to want to learn more about this type of care. So, um, what let's move on to what inspired or led you to go down this path in geriatric care?
There were actually a couple of factors that inspired me to seek a career in aging. So the first was actually I was born to parents who kind of got started a little bit later in life. So my parents are two generations removed from me, and they were a little bit older when they had kids. So anytime we would have a party or a social function, I hung out with older adults, even as a child. So I had a baseline comfort with that demographic already, just growing up. I didn't grow up in an intergenerational household or anything like that, but my parents were just a little bit older, so I had exposure to that group in the first place. Then in college, for my undergrad specifically, I was working with an advisor for my honors program for exercise science, Dr. Tina Trustadottir. She is one of the most intimidating but smartest people I've ever met, and she's an aging specialist on the exercise physiology beat. And her passion and advocacy for aging well and physical activity throughout the lifespan was absolutely infectious. And I really think that that helped to continue to drive me in the direction of seeking a career and working with older adults.
Yeah, that's one thing I've heard pretty constant through interviewing all of EIM's faculty is there's always one or two people responsible for like inspiring their career path, which is pretty powerful. So very cool. So let's move into some of the, the offerings through EIM under this geriatric care umbrella. Maybe we'll start with, well, how does integrating geriatric practices into your own practice as a clinician take your ability to care for your patients to the next level? Let's start there.
Yeah, so I feel like having an idea as to what could potentially happen to somebody in the future as they enter their older adult years is an extremely powerful viewpoint to have. Geriatric care, and especially going through my board certified geriatric clinician training for my APPTS specialty, you aren't necessarily just looking at 65 and later. You actually have to have an appreciation for what's happening to somebody in childhood and adolescence and young adulthood, middle adulthood, to see what causes this, so to speak, perfect storm that can result in some of these negative aging consequences. So, having and keeping in mind kind of what geriatrics is and what some of the situations people who are older can face medically or health-wise or physical activity or mobility-wise, gives you some better perspective as to what could happen in younger populations as well. And I think one of the biggest misnomers that I hear from, especially more so orthopedic clinicians and outpatient, is I hear them say, "Oh, I'm not a geriatric therapist." But if they're working with people that are middle-aged or in their, 40s, 50s, 60s, they are working with people that if they are, some of these people could be at risk for issues in the future. And we are not just looking at what happens after that arbitrary age of 65. Tim Kaufman, who's one of the founding fathers of the APTA geriatrics section of APTA, actually in his book talks about how aging begins the moment we're born, and we have to have an appreciation through the lifespan. So it really, I think, helps give us a framework for looking at what could potentially happen to somebody throughout their lifespan.
Yeah. So when partaking in the EIM geriatric certification, if you could talk about what it's like, and then maybe point out some of the things that are learned in that certification that would go above and beyond maybe what a PT would learn, generally throughout their regular curriculum.
Mhm. Yeah, so we have a couple of different tracks as far as the geriatric certification. We have a foundational certification, which is a 6-month program, which looks at intro to geriatric rehab, exercise prescription, wellness and health promotion, and then also has 2 in-person weekend intensives, one for balance and falls and one for orthopedics. That's really for more outpatient orthopedic clinicians who don't intend to specialize or get a board certification in geri, but need those basic skills to better serve their population. And then we have our advanced track as well, which is a full year. It's 12 months. That is for people who are intending to go for the full certification. And that includes online learning, in-person learning, faculty-led online. And the skills that we're teaching in both of these really encompass the 5 M's of geriatrics. So we're not just looking at, oh, here's osteoporosis and don't bend the spine, or, oh, be careful or prevent, don't let somebody fall. We really dive past just the very basic entry-level education and dive deep into mind, mobility, medication, multi-complexity, and what matters most. So the 5 M's of geriatrics. And we also make sure that and we've just recently updated everything, but every content module has clinically relevant and applicable information, stuff that you can implement into the clinic the day after you learn about it in the module.
Mm-hmm. Awesome. Where, so if someone watching right now wanted to learn more about these offerings, where would they go to learn more? I
Yep.
assume online.
Yeah, so you can find them on the Evidence in Motion website. I will also be happy to share my email as well, and you can reach out to me via email if you have more questions too. But we have the full content schedules as well as the schedule for all of the courses. So we accept learners in the summer and in the winter, so starting in July and then starting in January. So we have kind of rolling cohorts twice a year. But you can find more information online at the Evidence in Motion website.
Yeah, and I can attest for it's a very easy to navigate website, whether you're on a desktop, tablet, or other mobile device. So yeah, definitely go and check that out. Okay, well, great, Heidi. Let's finish up with just one more question. This will be more for the upcoming PT or OT. Maybe our assistants or anyone maybe even considering going into a career in physical therapy or occupational therapy or related field. With all of your experience, what's one key piece of advice you would give to one of these up and coming clinicians?
So the one piece of advice I would give to an incoming or up and coming clinician would be to stay flexible. So our understanding of the world changes every year, especially from a geriatric standpoint. As we have different generations aging who have had different health habits in their younger years and different exposure to different things such as nutrition and exercise and physical activity to different levels, our understanding of how people age changes every single year, and understanding that that is an expectation and what you learn in school is not going to be the end all be all, and you do have to continue to take education, continuing education to stay up to date is extremely important. Also, make sure that you are plugging into a content area that you're most comfortable with and excited for. So if you are not interested in working with pediatrics, the fun thing about PT and OT is you don't necessarily have to. You can choose a different career and go more older adults. If you don't like older adults, you can work more with neuro, although I will warn you, there's a fair amount of older adults everywhere you go. But there is some flexibility as far as finding your passion. But if you find a population that you're really, really passionate about, that's going to make the difficulties that we face in the healthcare field a lot more manageable and help to create a longer career for you.
Yeah, all wonderful advice. Well, that's gonna wrap things up here, Heidi. Thank you so much for sharing all this information. This is a lot of information in a short period of time. We covered everything, and I think you really provided some value. So we really, really appreciate it. Is there any final words you wanna leave with here, or are we good to go?
No, I'm good to go. I just want to say thank you so much for having me, and I look forward to potentially answering any questions about our geriatric content or just geriatrics in general.
Excellent. All right. Well, thank you so much, Heidi. Thank you from everyone here at OPTP and EIM. And stay tuned for our next episode of Next Level. We'll see you guys soon.